Dr. Price, good to have you on the program, sir.
Hey, Tavis, thank you so much. Great to be back with you.
I look forward to asking this same question of Eddie Bernice Johnson, Congresswoman Johnson, in just a moment. But Speaker Pelosi is proposing to pass an amending bill through the budget reconciliation process. What exactly does that mean to you when you hear that?
Well, it remains of great concern, not just to me, but I think to the vast majority of the American people, because much of this is being done behind closed doors and out of sight. As a physician, for something that's as personal as health care, we believe strongly that these ought to be open debates, open discussions, so that the American people can know who's making the deals, who's getting the deals, what kind of deals are they cutting.
Does this move by Speaker Pelosi surprise you in light of, with the backdrop of the conversation that the president recently had with your caucus, where you all implored him to listen more to your ideas about health care?
Yeah, sadly, it's occurring, but it's not surprising from the speaker, because that's basically been her stock and trade, what she does, how she operates, and that is again behind closed doors and shutting people out, not just of the Republican conference, but members of her own Democrat caucus, who disagree with her. She shuts them out as well. And that's really sad for the American people, because they recognize that the best ideas, that exchange of ideas, isn't happening. And again, in something so very personal as health care, for each and every one of us, we strongly believe, I believe, that the medical decisions need to be made by patients and families and doctors, and not by the federal government. And that's the bottom line.
But you do not believe, though, that our healthcare system isn't broken and in need of being fixed in some ways?
Oh, no, Tavis, as you and I have talked about, the status quo is unacceptable, clearly. And I've been, one of the reasons I came to Congress, one of the reasons I left my medical practice, was to try to be at the table when we were attempting to improve our system. We need to get more people covered, need to get all Americans covered with some reasonable and responsible form of health coverage, but coverage that they select for themselves and their families, not that the government selects for them. The insurance challenges of portability. You ought not lose your insurance if you change your job or you lose your job. And pre-existing, you ought not be priced out of the market if you happen to have an awful diagnosis or a bad injury. And then we've got to get rid of the lawsuit abuse. You can't be serious about health reform if you're not serious about lawsuit abuse reform. So those are the things that we believe ought to be happening, and none of those are happening in a way that I believe is responsive to patients.
You just laid out your public policy dictates or public policy concerns about health care reform. Let me ask you a question that, again, I expect to ask Congresswoman Johnson in just a moment here, given that she was a former nurse. What uniquely does your experience bring to the table in this debate, given that you are a certified medical doctor?
Well, I practiced orthopedic surgery for over 20 years, and I know that when my patients had concerns about who was being able to make decisions and how our medical decisions were being affected, whether it was by the intervention of an insurance company that said this is what you've got to do, or by the federal government or state government, for that matter, that said this is what you have to do, they bristled. They said that's not where decisions ought to be made. Medical decisions ought to be made between patients and families and doctors. And sadly, the legislation that has gone through the House and gone through the Senate would make it so that would no longer necessarily be the case. And it's very concerning to all Americans.
I guess the question is, Dr. Price, whether or not the GOP, the Republican Party, really does have better solutions. There are a lot of people in the country who, and this came up in that meeting you all have with the president, a lot of folks think that your party has been a party of obstructionists on this issue. And
I know that's the kind of the line that's used out there in the political arena of give and take. But the fact of the matter is, as chairman of the Republican Study Committee, we have put forward positive solutions to all of the challenges that we face, including health care. And H.R. 3400 is the bill that we put forward mid last year at about the time that the House bill came out in July. And I urge people to take a peek at it. It is the bill that we believe would result in patient-centered health care, not favoring government and not favoring insurance company, but in favoring patients, which is where we ought to be.
Finally, where is this debate going to end up? I think the American people right now are just trying to figure out, Are we going to get reform? There have been so many political machinations and changes, and Scott Brown in the Senate. And where's this? How's this thing going to shake out in the end?
Well, it's an open question, as you well know, Tavis, and we'll see how it works over the next couple of months. But I think where the American people want it to shake out is to allow their representatives to talk openly and honestly and move toward a solution that incorporates ideas, good ideas, from all across the political spectrum. There's no one corner on great ideas, and the health challenges that we have aren't Republican challenges or Democrat challenges. They're American challenges. And if we were to be able to through the leadership in the House, be able to be given an opportunity to talk together, speak together, come up with those solutions, I think that the American people would embrace them. I'm worried that what's going to happen is that they'll make some deal behind closed doors in order to get the votes, and then they'll jam it through. I think that would be destructive, not just to the cynicism that exists across this land about Congress, but destructive to the patients of this land.
Tom Price, M.D., represents the 6th Congressional District of Georgia. He's also chairman of the Republican Study Committee. Congressman, good to have you back on the program.
Thank you so much. Great to be with you.